Hi everyone, we're so glad you're here. I'm Dr. Jonathan Weiler, founder and medical director of Rejuvime Medical.
And I'm Rosalind Kenny, medical provider here in Baton Rouge. We want to officially welcome you to our event, Reset and Recharge, Jumpstart Your Weight Loss Journey.
Over the next few minutes, we will be walking you through how our combined weight loss and hormone replacement approach helps patients feel better, function better, and reach meaningful long-term results.
We encourage you to stay tuned until the end of the presentation for a live Q&A where Dr. Weiler and I will be able to answer any questions you may have. You can submit your questions via the Questions tab.
As a thank you for joining us today, we're offering a new patient special. When you move forward with care, you'll receive a $50 credit towards your first medication order. To qualify, labs must be completed by January 31st. Please note this credit cannot be applied to lab work on your initial provider visit.
And as an added bonus, one lucky attendee will win a free consultation and complimentary lab work, a $250 value.
Let's get started. All right, so let's kick things off with one of the most common questions we hear. What actually causes hormone levels to drop in the first place?
The biggest factor is age. As we get older, our bodies naturally produce less of hormones like estrogen, testosterone, and progesterone. It's gradual, and most people don't notice until the symptoms start creeping in. Things like fatigue, slower metabolism, mood changes, and stubborn weight gain.
Yep, and that's the key right there. It's often the metabolic changes people feel first. They're eating the same, moving the same, but their bodies just aren't responding the way it used to.
Exactly. And age isn't the only reason hormone levels shift. Stress plays a huge role. When your body is constantly producing cortisol, it can interfere with other hormone systems. Poor sleep, certain medications, inflammation, and environmental toxins can also contribute.
Yeah. And for women, those shifts can accelerate during perimenopause and menopause. For men, testosterone can start declining earlier than they expect, even in their 30s and 40s.
So when hormone levels drop, whether from age, stress, or lifestyle factors, your metabolism becomes less efficient. Your body burns fewer calories at rest, holds on to fat more easily, and recovery gets slower. It becomes much harder to lose weight even when you're doing all the right things.
And that's why so many people come to us saying, I feel like my body isn't working the way it used to. It's not willpower, it's physiology.
Right, and this is really the foundation of what we're talking about tonight. Understanding how hormones and metabolism work together, and how supporting both through proper hormone balance and medically supervised weight loss can make the process much more effective. So once we've identified what hormone levels are off and put together the right treatment plan, the next step is deciding how to get those hormones into your body.
Exactly. At Rejuvime, we have several different delivery methods. And the one we recommend really depends on your lifestyle, your goals, and how your body tends to respond.
We offer injections, which are great for people who want consistent levels and don't mind a weekly routine. They're effective, predictable, and we teach you exactly how to do them at home. You can come into clinic and we'll take care of it for you as well.
And of course, then there are pellets, which are tiny rice-sized implants placed just beneath your skin in the buttock area. They release hormones naturally and steadily over several months. So there's no daily or weekly maintenance. It's a set and forget it option that a lot of patients really enjoy.
We also use topical creams and oral capsules when they're the best fit, especially for fine-tuning things like estrogen or progesterone. They can be great tools depending on someone's specific needs.
The important thing to understand is that there's no one-size-fits-all answer. When you look at your labs, your symptoms, your medical history, and your lifestyle.
And then we help you choose the method that's going to give you the best results with the least amount of hassle. Our goal is always to make this process as effective, convenient, and personalized as possible.
So starting hormone therapy and weight loss treatment isn't just a one-time thing. And honestly, that's a good thing.
Right. Your body is very dynamic. Hormone levels, metabolism, and overall health can shift over time. So we check in with you regularly to make sure everything is working out the way it should.
You'll have a routine follow-up labs and scheduled visits, some in person, some over the phone, to make sure your levels are not just in the range, but in the optimal zone where you actually feel your best.
And it's not just about lab numbers. We talk about how you're feeling day to day, your energy, your sleep, your mood, your progress with weight loss, and how your body is responding overall. If anything feels off or needs adjusting, we make those changes right away.
Exactly. These check-ins help us fine-tune your treatment so you stay on track toward your goals. We also encourage open communication. If something changes, big or small, we want to hear about it.
Our goal is long-term success, not just quick results, but sustainable improvements in how you feel, function, and live.
So we're with you the whole way, monitoring, adjusting, and supporting you throughout your journey.
Because at Rejuvime Medical, your health and your progress are always the priority.
All right, let's shift into weight loss, specifically GLP-1s and GIP medications, which have truly changed the game. If you've heard of the names like semaglutide, tirzepatide, Wegovy, and Zepbound, that's what we're about to talk about.
These medications mimic hormones your body naturally produces in the gut. GLP-1 slows down how quickly your stomach empties, making you feel fuller longer. It also signals the brain to reduce hunger and cravings while improving insulin sensitivity, so blood sugar stays more stable.
And then there's the GIP, which works right alongside GLP-1. When the two are combined, like in Zepbound, they amplify each other. Together, they help regulate appetite, improve how your body uses energy, and create a really powerful synergy for weight loss.
They also help support better body composition. Patients typically lose fat while maintaining or even improving lean muscle, which is exactly what we want for long-term metabolic health.
Like any medication, there can be side effects, things like nausea, constipation, or diarrhea. We always start patients on a low dose for the first 4 weeks to make sure they can tolerate it. And then we slowly increase it every 4 weeks.
That slow, steady approach helps minimize side effects and reduce the risk of complications.
At Rejuvime Medical, we use GLP-1 and GIP-based therapies to help patients achieve sustainable long-term results, not a quick fix, right? And when these medications are used under proper medical supervision, they become a powerful part of a comprehensive weight loss strategy.
So now that we've talked about how these medications work, let's walk through how they're actually delivered, because that plays a big role in how effective they are.
The most common and most effective delivery method is a weekly subcutaneous injection, meaning it goes right beneath the skin, right? This allows medication to be absorbed slowly and steadily over time, which is exactly how these peptides are designed to work.
And the good news is the injections are tiny, very easy to administer, and most of our patients say they barely feel them. You can do them at home, or if you prefer, you can come into the clinic and we'll take care of it for you.
There are some oral versions out there, but they have to pass through the digestive system, which means they're not absorbed as efficiently. They also tend to require higher doses, daily administration, come at a much higher cost, and can have more side effects.
Yeah. Because of that, we don't recommend oral options, and we don't offer them here at Rejuvime. Weekly injections give you the safest, most consistent, and most predictable results.
And we want the process to be convenient too. You can have your medication shipped directly to your home, or pick it up and you can do it right here in the clinic.
Your weight loss journey should fit into your life, not complicated. Our job is to make the process simple, effective, and aligned with your goals.
So let's talk about why medically supervised weight loss is so important, especially when it comes to GLP-1s and GIP medications.
These medications are incredibly effective, but they also affect your metabolism, your blood sugar, your digestion, and even your hydration levels. That's why having a medical provider involved isn't just helpful, it's essential for safety and long-term success.
Exactly. Under our care, we're not just handing you a medication and sending you on your way. We're going to monitor your labs, track your progress, evaluate side effects, and make adjustments to your dosing at the right pace so your body can handle the changes.
And it's not just about preventing side effects, it's about maximizing your results. When your dosage is managed correctly and your hormones are balanced, and when you're supported nutritionally and metabolically, you can get better weight loss outcomes.
We also help you understand what to expect week by week, what's normal, what's not, and how to stay consistent. That guidance alone makes a huge difference.
And the goal isn't a quick fix. It's safe, sustainable, long-term improvement in your health and medically supervised weight loss that gives you structure, accountability, and protection.
It's a partnership. You're not doing this alone. You have a full medical team supporting you, monitoring you, and celebrating your progress every step of the way.
At Rejuvime Medical, we take a whole body approach to wellness. When it comes to weight loss, pairing it with hormone optimization can really amplify your results in ways most people don't expect.
Hormones play a major role in how your body manages weight. When they're imbalanced, whether from age, stress, or lifestyle factors, your metabolism slows. Fat storage can increase and your energy levels drop. All of that makes losing weight a lot more challenging.
Our weight loss programs, especially those that use GLP-1 and GIP medications, help regulate your appetite and improve insulin sensitivity. But when you combine that with HRT, we're also addressing those deeper hormonal issues that contribute to weight loss resistance.
And that's where you really see a synergistic effect. Patients often experience better fat loss, improved muscle preservation, more stable energy, and overall better long-term success.
Here at Rejuvime, we build personalized plans that combine these therapies strategically. So you're not just losing weight, you're feeling your best while you do it.
That's right, it's a smarter, more complete approach to total wellness.
And together, it creates the pathway to results that are not only noticeable, but sustainable.
I'm Ashley, I'm 49. I am currently on a GLP-1 with Rejuvime Medical. I've lost about 32 pounds total in the year that I've been on treatment. I really started feeling so much better, so much energy, a total difference in everything.
I've noticed that my mental clarity is better. I'm able to focus more, my energy levels are up, and I bounce back in the gym more like I'm in my 20s and 30s. I feel like myself again, stronger, sharper, and ready to take on anything.
Thank you all so much for joining us tonight. We really appreciate you spending this time with us and hope the information was helpful.
Absolutely. We're truly grateful that you're here, and we hope you feel clearer and more confident about your options moving forward.
Before we wrap it up, just a quick reminder, stay tuned for the live Q&A with myself and Rosalind so that we can answer any questions that you may have. Also, one lucky attendee will win a free consultation and complimentary lab work worth a $250 value.
We invite you to chat with us for the next 15 to 20 minutes by submitting your questions through the questions box. We're here, we're listening, and we'd love to help however we can.
Also, be sure to check your text messages after the event and reply back so somebody from our team can contact you to schedule your consultation.
Thanks again for being with us, and we look forward to supporting you on your reset and recharge journey with Rejuvime Medical.